Our next guest has been an advocate for clinical pharmacy as a pharmacy owner and an operator. She has also developed safety protocols. Please welcome Lidia Molinara. And Lidia, please share kind of the behind the scenes information on why safety is such a concern in healthcare.
Well, as a pharmacist of over 30 years, I have been on the front lines. I have seen so many preventable situations when it comes to medications, as well as people within their healthcare journey and just asking questions within their specialists or doctors and things that can be done as a preventative tool so that they really get the most out of their medications or even looking at their healthcare journey. And safety is number one. We know that, crazy to think, but a jumbo jet falls out of the sky basically every day due to medication related errors in a year. And we see that the fourth leading cause of death ahead of car accidents can be related to medication. So we really have this safe medication culture. We know that a lot of people take medications, and every time you add a medication, there's a risk for an adverse event, which means, problem or situation happening when you're taking that medication and side effects that can happen. So it's really trying to understand that medications really are there to help us, not harm us. And there's tools and techniques you need to be aware of so that they do exactly that for you.
Can you talk about those tools that you were referring to that we can use?
It's so simple, but yet complex all at the same time, which sounds crazy, but true. Because when we look at medications and we look at the healthcare journey, we know that when we go in to see a doctor, oftentimes, I'm sure we can all relate, we kind of feel like, hey, I'm going to leave with a prescription, then I'm going to feel better. So we know that the statistics are high, right? You expect to go to see a doctor to get you put on a medication so that when you leave, you have something that's going to make you feel better. So our therapy and our way to heal things, number one is drugs. So what does that look like in how you protect yourself? There's 3 steps to protecting yourself. What I like to say is it's your look both ways before you cross the road skill set. Number 1 is the concept of advocacy. Number 2, communication. Number 3, education. So when we look at advocacy, you need to be able to speak up. You need to remove any barriers that you have in asking questions, in feeling intimidated that to ask a question means that you don't trust your healthcare professional or that you're challenging them. We need to remove those barriers. Advocacy also goes to really knowing that when something doesn't feel right, that you need to be an active participant in your healthcare because you know your body the best. A lot of people are trying to help you solve whatever condition or problem there is, but you're the one who knows and feels it, and you need to be able to advocate on that behalf, on your behalf and on that regard, whatever that condition looks like. When we look at communicate, I like to say communicate is not just speaking, it's also about documentation. So if you're going to be starting a new medication, you need to be able to document, write down, talk in your phone, make a reminder. How many times do you feel like you've had a headache? How many times have you gone to the washroom because it's caused an upset stomach? Or now you're waking up in the middle of the night to go to the bathroom. We don't think about it being the medication. And often I say when you're starting a brand new medication, anything that happens while you're starting that brand new medication, you should document, write it down so that you see a pattern, so you understand if it's working. You don't just stop something right away, but you have the documentation, the information. It's powerful, extremely powerful in knowing how and what to do if something does go wrong. And then the third piece is educate. And what I mean by that is knowing the questions to ask. Why are you on this medication? What's the purpose of the medication? How should I take the medication? It's all your 5 W's, as well as writing that down and then researching. People often say, oh, you shouldn't be doing the Dr. Google thing. You shouldn't be trying to diagnose yourself. I'm a proponent of You should be actually looking on the internet and checking things out, but from credible sources. So the educate piece is talking to other people, talking to other healthcare professionals, speaking to your pharmacist frontline about your condition, about the medication that you've been put on. Having those conversations, you would be amazed and surprised as to how much you're going to learn about your medical condition, and also the things that then spark discussion, and having your active participant part of you go back to the doctor, go back to the pharmacist, go back to a caregiver, whatever that looks like in your situation, in your healthcare journey, whoever's involved in that with you, you'll be able to make good, solid decisions based on the questions that you ask. And the number one line theme in all of this is that the risk of whatever you're doing, surgery, medication, outweighs and isn't bigger than the benefit. So the benefit always has to be better than the risk. And each individual person is going to have an answer to that question. And if you have all three of those things, you're going to be able to, like I say, reduce harm and actually ace your healthcare journey. It really is that important. All three of those elements. And they're simple. It means speaking up, documenting, doing some research, and then asking more questions.
Why do you think so many people are hesitant to ask their healthcare provider questions about medications that the provider obviously wants to put them on, and they don't want to ask questions, well, will it interact with this? Or is that something for the healthcare professional, or is it something more for the pharmacist to answer?
It's a bit of both. Like I said, you need to become an active participant in your healthcare. That's number one in reducing harm. Because if you're not going to ask those questions, then you're not going to be able to really understand what is happening. The barrier that I often see is just the factor of intimidation sometimes. It's, I don't want to feel like I'm challenging the doctor. He knows best. I don't want to interrupt the pharmacist. They're really busy. But I think we have to shift that. We have a safe medication mindset. We have a safe culture where we think the healthcare professionals know best. And I'm not suggesting that they don't. What I'm saying is nobody knows you better than you. So healthcare is a different language. There's also that on top of everything else. So if I were to say to you, oh, that medication is going to cause general malaise, you might know, but you might not know what that means, but you don't want to say that you don't know what that means, but you should. So you really need to have clarity in what is happening. And the barrier, I think, behind all of that is that sort of feeling like, well, I don't know. Should I be asking this question? No stupid questions. You should ask everything and anything that you have a feeling about, because it's going to prevent errors. And I really do believe that if you go ahead of time and you have a list of questions to ask, you'll feel less about, should I ask this? And more so, I've got a plan of action. So I'm going to go in. I've read about this. Now I'm going to ask my questions. I've spoken to the doctor. I have an idea behind my risk versus benefit on taking this new medication or this new procedure or trying this surgery that I'm going to have. See if that's going to work. What is the best thing for me? If you have the list of questions ahead of time, I think it feels a little bit safer and a little bit easier to just ask the questions. And when I think about the comparison, if you're renovating your kitchen, you'll never have an issue asking the contractor questions. And if he says, and you guys come up with a plan and say, it's going to be a beautiful wood oak and white cabinetry and the island's going to be colored black, all of a sudden, if you walk in and you see that that's not what's happening, there'd be no hesitation to say, no, I didn't pick that. I want this. Your healthcare journey has to look exactly the same way. You come up with a plan, you look at what you feel you need to do, you understand the risk versus benefit, you come up with that plan. Things might change along the way. The contractor might say, oh yeah, no, that color is not available. You might have to try this. Same thing happens in healthcare. A new discovery. We now found out through this x-ray, this is what's going on. You still ask the questions. You still become part of that process. Don't look at it any other way. I think we just get intimidated because there's so much we don't know and understand in healthcare. And it's not just as simple as, let me look up that paint color. But in fact, when you become an active participant, you'll be amazed at how much you can actually impact in your own healthcare journey.
Lidia, stay right there. We've got lots of other questions to ask you, but we need to take a break and we'll be right back with more Lidia right after this.